Is microfat and nanofat transfer. Microfat consists of small, same-size fat particles and is used to volumize certain areas on the face, such as the temples, the eyebrows, the nasolabial folds, the marionette lines. It helps with contouring the jawline and addressing wrinkles and deep grooves in the neck as well. It can also be used to augment the upper and the lower lip. Nanofat instead consists of very, very small, smaller than the microfat, fat particles, which are non-alive, but it contains very high concentration of stem cells. So nanofat is very rich in stem cells, and stem cell is the cell that it can differentiate into collagen-producing cell, and it leads to a vast production of collagen, which is the main protein that helps to make the skin tighter, firmer, and more glowy. So when we use microfat and nanofat, we can achieve two things. We can volumize the face, and we can rejuvenate the skin of the face. And this is the double benefit that the fat transfer can offer. What are the advantages of microfat and nanofat transfer? Well, when we use microfat to volumize the face, we replace like with like tissue. What does this mean? One of the signs of the aging face is that certain fat compartments, islands of fat in the face, become smaller and smaller with increasing age. So what the microfat transfer does is it replaces the atrophic fat tissue. And in other words, we replace like with like tissue, we replace fat with fat. And the fat tissue that we use to replace the shrunken fat is fat from the patient's own body. We just harvest it from a different area and we transfer it and inject it into the area or the areas that we want to address, in this case the face and the neck. Another advantage is that the fatty tissue coming from the patient's own body, it is very well tolerated, it doesn't get rejected, it doesn't cause chronic inflammatory reactions or foreign body reactions, and it integrates well with the already existing fatty tissues in the area where it is injected. And when we combine microfat with nanofat, we can achieve volumization as well as rejuvenation of the skin. And this is the double benefit that the fat transfer can offer compared to injectable filler products. What can a patient expect from a fat transfer procedure? Well, this is a relatively straightforward procedure which can be done under local anesthetic. And it involves ejecting a solution of different medications that help with addressing the bruise and the swelling. That's called tumescent solution. We inject that solution into the area that we want to harvest the fat, such as, for example, the abdomen. And then we use a special cannula called a microcannula, and we gently harvest the fat from the body. Once the fat is harvested, then we use a fat processing device to convert this fat into microfat and nanofat before it is injected to the face. And there are lots of different fat processing devices available in the market. The device that we use and has been thoroughly researched and its safety and efficacy has been proven is called LipoCube. So LipoCube is a device where we can convert the newly harvested fat from the patient's body into microfat and nanofat. So once we use this device and we obtain microfat and nanofat, we use microfat and we inject it using special small cannulas called microcannulas into the area or the areas that we want to address. And microfat will provide volume to the face. And then we inject nanofat in various different areas to stimulate new collagen formation, thus creating a firmer, tighter, more glowy skin. This procedure is associated with minimal downtime. That means the patient can go back to work the next day, and the swelling and the bruise usually last on average 48 to 72 hours. In patients who tend to bruise more, it can last for about 5 to 7 days. So it is a procedure that is fast. It can take about 60 minutes in duration, and then it is associated with fast downtime and very early return to daily life activities.